Welcome to One-on-One with Expert Flyer. This is your host, Lisa Caslin. Yesterday, the CDC gave the final sign-off to Pfizer's kid-sized COVID-19 shot, a milestone that the travel industry no doubt hopes will encourage more parents to travel with their young children. To talk about this today, we've invited Dr. Cornelius Ferreira. He's a family medicine physician, and he's also the leader of Nuvance Health's COVID-19 vaccine Taskforce. Welcome, Doctor.
Thank you so much.
Yeah, absolutely. It's good to have you, and it's really nice to have a true expert on the line to demystify some of the myths, some of the fear that's going on among the parental community when it comes to vaccinations and travel and all that good stuff. I find it interesting that a survey that the American Academy of Pediatrics did this year cited that less than half of the participants, and there was over 1,700 parents that were surveyed for this, said that they would actually vaccine their kids. And I just wondered what you thought about that.
Yeah, so to me it's a somewhat scary statistic that less than half are going to follow through with the vaccinations. We know today that vaccines, right, whether it's COVID-19, whether it's polio, whether it's influenza, these vaccinations do save lives. When we look at the millions of doses administered across the United States, including the globe, right, over 7 billion doses given, we know that these vaccines are safe and highly efficacious. So we really have to work with parents to understand the importance of the vaccines, review and reassure with them how safe these vaccines are, and then I think debunk some of the myths that have come out through many different avenues over the last several months, right? Whether it's the media, whether it's family or friends, we really have to look at the science to understand that these vaccines are safe. And the reason we've made so much headway in the COVID-19 pandemic is because we were able to stand up vaccinations so quickly and effectively over the last 12 months.
Yeah, no, it is absolutely true. I just wonder, and, obviously, look, vaccinations like, polio, for example, I mean, really, changed the game back in the day. But I think parents are still kind of worried because, there was such a short runway of time, between coming out with this vaccination and true testing and seeing how things sort of play out. So, I guess the worry is that, the testing on children may not have been that comprehensive, and therefore, they're unsure or fearful. What do you say to that?
So, so I will say, so that certainly is something that I hear in my own practice. The good news that I will say is, specific to this age between 5 and 11, there's been excellent studies in over 3,100 children where the vaccine has been proven not only to be safe but also efficacious. And then if you look at the last several months after Pfizer got approved for the group 12 and older, millions of those doses have been administered across the United States. And in that patient population, right, the side effects and the adverse events were relatively low. I still urge parents, and I tell them that you have to look at the disease, right? If your child gets COVID, in the initial stages of COVID, right, we obviously saw that there were a lot of children who had a lower incidence rate, so not as many children got COVID. But certainly with the advent of the different variants, right, including the Delta variant that we saw over the last several months, we know that the children who got infected got very, very ill. And that was actually one of the areas where we saw quite a bit of death associated with COVID-19 in the pediatric population because those vaccines were not available, and the disease and the impact of the disease is so much worse on those kiddos.
Yeah, okay. So, obviously there's been some debate over natural immunity. And, experts believe that is one of the significant barriers to immunization, at least, in adults. What do you say about that? So if someone did have the virus, is their natural immunity not as effective as getting a vaccine?
So immunity plays an important part, and I guess the best way to equate this for the viewer, for the listeners, is you have to think about the different strains. So as the virus mutates and different strains develop, the ability of your body to fight the virus becomes challenged. And that's why, for example, with the flu vaccination, every year we do a flu vaccine, and it's a little bit different than the previous year based on the current circulating strains. So even for individuals who've had COVID-19, the recommendation is still to go out and get vaccinated, because the vaccines actually help to bolster that immune system and helps to fight off these new strains, because it helps the body mount a different immune response to the different strains that are out there. So the beauty with the COVID-19 vaccine, like I said previously, it's very safe, very efficacious, but the fact that it can help your immune system mount a better response, better protection against the virus, that's where the neat piece comes in. The key thing is, right, when we look at people who've had COVID, the Centers for Disease Control and all the studies say, even if you got the disease, go out and get the vaccine as soon as you feel healthy enough to make sure that that vaccine is in the system. So the answer there is get vaccinated. The natural immunity is important, but this is an adjunct and a booster to that to keep you safer in the long run.
Okay, fair enough. All right, so let's head over to the subject of travel, and as it relates to families and COVID and all that good stuff. So if there's, let's just say, over 50% of families who are still unsure or dead set against the vaccination, but they still plan on visiting their distant family and friends this holiday season, are there any specific precautions that they should be taking if they're traveling with kids who have not been vaccinated?
Yes, so the neat thing that we learned through the pandemic was the importance, right, of the things that we've known in healthcare for many decades, right? So the first one is we know that masks help. Masks are definitely extremely beneficial to help with droplet spread prevention. And I tell parents, when you go out, make sure that you get those kiddos masked. I know that's a little bit more difficult for the young ones, but for the vast majority of them, they do quite well. The second piece is we have to make sure we follow hand hygiene, so having that hand sanitizer handy or washing those hands as frequently as possible after you touch objects is also something that's really important. And then the other thing is, people tend to congregate in these crowded spaces, so the 6-foot distancing still remains one of the most important pieces as we try to avoid that coming into contact with ill people. And then the other thing that I would tell parents is to, certainly take a peek at the CDC website, but use vigilance if you start to see any kind of symptoms associated with the kids or anybody else in your party traveling. So if they start developing a fever, a cough, stuffy nose, being very, very tuned into those symptoms as potentially being COVID, and making sure that you have a plan to isolate and then test if you arrive at your destination to make sure that you keep those traveling with you safe and that you do not spread the virus to somebody else.
Yeah, the only thing that's that is a challenge in that situation is the 6-foot distancing, because when you're on an aircraft, you're dealing with inches of space rather than feet in some cases. But what do you think is the overall risk for unvaccinated kids spreading COVID to others around them?
Yes, so children and adolescents, can be infected with COVID just like adults. They'll get sick and they can spread the virus to others just like in the adult cases. Like I mentioned earlier, there were several studies conducted during the early COVID-19 pandemic, and those suggested that the incidence rate among children and adolescents were lower than that amongst adults. But since then, there have been more studies that have done systematically and tested children and adolescents. They looked at them whether or not they had the symptoms or not of COVID-19 or even a prior infection, and they found that the rates of infection can be comparable and in some settings maybe even higher than in adults.
Wow.
So basically, compared with adults, children and adolescents who are infected with COVID-19, they're more commonly asymptomatic, right? Meaning they never get any symptoms of the disease, but they can still spread the disease just like adults, right? And then the vast majority of children will end up having mild and non-specific symptoms. So it's not your typical picture that you see with COVID. They may just complain of a little bit of a headache or a sore throat. Mm-hmm. But similar to adults with COVID-19 infections, those kids and adolescents can spread the virus to others when they don't have symptoms or even mild symptoms. So it's very important that we monitor those kids for any of those things and then take the necessary precautions and have them evaluated by their doctor.
Is there an easy answer to the question of, why is it that children that do contract COVID-19 are not as brutally affected by the disease as an adult might be.
Yeah, so there's still a lot of research that's ongoing, and there's still a lot of questions out there. I think the beauty of children are that their immune systems, right? The vast majority of children are relatively healthy. So you don't see the same number of comorbidities that we get in adults. For example, diabetes, morbid obesity, pulmonary disease, chronic obstructive lung disease, or emphysema. So I think that helps to protect those children to a degree. And then obviously their immune systems are still developing and quite vigilant to help protect them against infections. So I think those are some of the things that may be playing a role in helping to protect our children.
That makes sense. All right, so here's the bottom line question. Is flying on a commercial plane any riskier for unvaccinated children and families than attending school or dining at a restaurant?
So, so the good news here is, most viruses or germs don't spread easily on airplanes because of the way that air is circulated and the way that air is filtered on airplanes. I will tell you, I had a recent trip, and I was so happy to see there was actually big signs on the airplane that said, HEPA filtration in place, air being circulated every 2 minutes. So I think the airline industry has done a really good job of trying to secure and keep us as safe as possible on those flights. The other thing that's interesting is, right, the air volume in the airline cabins, that's refreshed every 2 to 4 minutes because of that HEPA filtration system that they have in place. And then I tell people also, most airlines, if not all, require people when they're on the airplane, unless they're taking a sip of a seltzer or soda or eating something, that they have to wear their face coverings. And again, right, going back to our earlier discussion, mask use is vital to helping to prevent spread. And then even with these appropriate precautions, there's still the important factor that you want to minimize the time that you're on the airplane. So you want to see if you can take shorter domestic flights, right, that get you to your destination more quickly, but with shorter exposure to other people. But you still have to remember that even though the airlines, the HEPA filtration is in place, you may wear your mask, there's a congregation of people, and as you said, sometimes inches, given the tight seating on those airplanes, you should undertake any kind of travel with serious consideration for your own health issues, your fact that you may be vaccinated versus unvaccinated, just so that you don't take that flight and think everything's going to be fine. You really have to weigh the pros and cons.
Okay, good point. So debunk this myth for us. There's this widespread conspiracy theory that the vaccine could affect fertility. Is there any truth to that?
So, so that's one of those internet myths that has been wildly publicized. So we know that based on the studies that have now been done in pregnancy and pregnant women, and even those anticipating pregnancy, that the vaccine does not affect fertility whatsoever, right? There is no scientific method or process for these vaccines to affect that, both in female or male patients. The organizations such as the American College of Obstetrics and Gynecology, the American Academy of Pediatrics, they all recommend getting the vaccine because there simply is no truth in the fact that it's associated with infertility. And the most alarming piece that we saw was in the initial phases of COVID and even into 2021, there were a lot of pregnant women and who were skeptical of getting vaccination. And unfortunately, those were some of the individuals who got the sickest with the Delta variant. And there was tragic stories all over the internet and in journals on pregnant women who were not getting vaccinated, who either lost their own lives or their baby. So I tell people no evidence to show that any association with fertility, and even if you are pregnant or planning to become pregnant, the vaccines are safe.
Okay, that's really good news. Thank you for clarifying that. All right, so before we let you go, is there anything that I didn't ask that I should have that is important for families to know who are traveling for Thanksgiving and Christmas time and all of that good stuff?
No, I think we just need to fly and travel smart. So, wear your mask, wash your hands, try and avoid crowds as much as you possibly can. And then I think the most vital piece right now for everybody going into the holiday season is go get your flu vaccine. That is just as important as your COVID vaccine. Both of them are safe. They save lives. They've turned this pandemic around for us. So I encourage everybody to enjoy their holidays. Just be smart, stay safe, and enjoy the time with your family, which is something that many people did not get to enjoy last year. So it's really neat to see how we've overcome the challenges and that we can now actually go and travel to see family again.
Yeah, it is good news. Well, listen, we wish you and your family a very happy holiday. Thank you so much for your time, Doctor.
Thank you so much, Lisa. Have a good day.